Hi, my name's Louisa, and I'm a harm reduction health educator at MaineGeneral. This video series covers roots of substance use. Today, I'll be giving an overview of the 5 roots of consumption we'll be talking about in our other videos. First, we'll learn all about how a drug high works in general, and then we'll be talking about ingestion, snorting, smoking, boofing, and injecting. To learn more specifics about these different types of use, including the risks and some harm reduction strategies, be sure to check out our other videos in these series. They're all located in MaineGeneral's harm reduction YouTube playlist. Your heart pumps blood around your body through tubes called blood vessels. Arteries are the blood vessels that carry your blood from your heart to the rest of your body. Veins are the blood vessels that carry the blood back to your heart. The pumped blood moving through those blood vessels is called your bloodstream. When you take a drug, it enters your body and travels to your blood vessels to enter your bloodstream. From your bloodstream, it's pumped by your heart to your brain. Once a drug reaches your brain, it begins to affect your nervous system and you'll feel a high. A high is affected by the time it takes a drug to hit your bloodstream, which affects how quickly you'll feel the high, and the amount of the drug that actually is able to hit your bloodstream, which affects how intense that high will be. So different ways of taking drugs change the speed and strength of a high. This means that while you might be fine, for example, when you swallow a pill, your body will react differently if you snort that same pill. That's why it's so important to understand how different routes of use impact your body. Ingestion is when you put a substance in your mouth and swallow it. This is usually how people take drugs like pills, marijuana edibles, magic mushrooms, and alcohol. It takes around 30 minutes to an hour for a drug to hit your bloodstream and cause a high after you swallow it. And this is a little bit longer than other routes of use. You also lose a decent amount of the drug before it reaches your bloodstream. This means that your high will be a little bit weaker than if you took a drug another way. Snorting is when you inhale a powdered drug through your nose. This is usually how people take drugs like Coke, speed, or crushed pills. You could feel a high as soon as 5 minutes after you snort because the drugs enter your bloodstream pretty quickly through your nose. You also won't lose that much of the drug, so the high will be pretty strong. You risk things like hep C, septum damage, bloody noses, and more with snorting. Smoking is when you burn a substance and inhale the gas that the smoke produces. This is usually how people consume drugs like marijuana, crack cocaine, and tobacco. Just like with smoking, you'll feel a pretty quick and intense high after you smoke. Some risks associated with smoking are hep C, lung damage, cough, and more. Boofing is when you insert a drug into your rectum or vagina. People usually boof with drugs like meth, heroin, and alcohol. Boofing, again, can cause a pretty quick and intense high, but there are risks like HIV, anal bleeding, STDs, and more. Injecting is when you use a needle to insert a drug directly into your body. There are 3 main ways to inject a drug: mainlining, skin popping, and muscle popping. Mainlining is probably the most common, and that's when you inject a drug directly into your veins. This is probably the fastest way to get high, and it also causes an incredibly strong high. Skin popping is when you inject a drug into your skin, and muscle popping is when you inject a drug into your muscle. With skin popping and muscle popping, it takes a little longer for the drug to actually reach your bloodstream and cause a high than with mainlining. So it could be as long as 90 minutes to feel a high after skin popping or muscle popping. There are risks like hep C, HIV, abscesses, vein collapse, and more with injection. Thanks for joining me today. We learned about how the drug high works and why it's important to understand how your body reacts when you take a drug in a certain way. We also went over 5 methods of consuming drugs, which were ingestion, snorting, smoking, boofing, and injections. At Next Step Needle Exchange, we offer a variety of supplies like cottons, needles, sterile waters, tourniquets, alcohol prep pads, BZK pads, triple antibiotic ointment, and Narcan. These materials help create a safer environment for substance use, reducing the risk of infections and other complications. Thanks for joining me today, and I invite you to check out more of our content located within MaineGeneral's Harm Reduction YouTube playlist.